Okay.
Lastly, I want to talk about cardiac tamponade, which is a form of obstructive shock. Some signs and symptoms you may see with this person may be present with dyspnea, tachycardia, and tachypnea. Cold and clammy extremities from hypoperfusion, elevated jugular venous pressure, pulsus paradoxus, chest pressure, decreased urine output, confusion, and dysphoria. When it comes to hemodynamic monitoring and findings, a marked increase in the end diastolic pulmonary artery, or the PA, right ventricular RV, and the right atrial pressure strongly suggests a tamponade. Using a Swan-Ganz catheter with someone with tamponade near equalization within 5 millimeters of mercury of the right atrial, right ventricular diastolic, pulmonary arterial diastolic, and pulmonary capillary wedge pressure will occur. When it comes to pharmacology or med options, dobutamine is it's the number one drug. So it's a synthetic catecholamine and a direct inotropic agent that stimulates cardiac beta receptors. It has a strong beta 1 but a weak beta 2 and alpha effects, resulting in increased cardiac output, blood pressure, heart rate, as well as a decreased peripheral vascular resistance. As far as mechanical ventilation and ABGs, these individuals namely just need oxygen. They can suffice with just oxygen. Mechanical ventilation may not be necessarily, but if it comes to the patient deteriorating enough, it may be necessary. It may be an option. As far as an ABG, one may see a metabolic acidosis given the excess fluid buildup. There is a specific concern for some patients on positive pressure ventilation. For instance, positive pressure mechanical ventilation should be avoided in some cases because it decreases venous return, cardiac output, and it can aggravate the signs and symptoms of the issues at hand, such as someone with a cardiac tamponade. It could potentially exacerbate the condition and cause more harm to them. But on the other hand, a little bit may be good to start with for someone of any other condition if necessary, but ultimately not the best for the patient, especially for an extended period of time.